All right, let's talk about something that's a reality in any clinical setting, managing a body fluid spill. Getting this right is absolutely critical for infection control. It's a core skill that protects patients, staff, and visitors from healthcare-associated infections. So in this explainer, we're going to walk through the proper protocol for handling these biohazards safely and effectively.
And just so you know, our entire discussion is grounded in the established protocols detailed in the work of Dr. Muhammad Al-Naghi Muhammad. This gives us a clear, evidence-based framework to build on.
So here's our game plan. First, we'll unpack the clinical challenge, why this is such a big deal. Then we'll look at the go-to disinfecting agent, hypochlorite, and the really important safety rules that go with it. After that, we'll get into the step-by-step procedure for managing a spill, and finally, we'll touch on a common alternative, Virkon.
Okay, Section 1, the clinical challenge. Let's start with the big picture. Why do we need such a strict protocol for this?
Well, it all comes down to pathogen transmission. Any spill of body fluid is basically a potential reservoir for nasty bacteria and viruses. This dramatically increases the risk of infections spreading within the healthcare environment. So managing a spill isn't just about cleaning up a mess. No, it's a critical intervention designed to break that chain of infection.
Section 2, hypochlorite. So, to shut down that risk of transmission, the disinfectant you choose is key. Let's talk about the recommended first-line agent.
And that agent is hypochlorite. You know it as a chlorine-releasing compound. Now, for a bit of the science behind it, the chlorine atom here is in a +1 oxidation state. Why does that matter? Because it makes it a super potent oxidizing agent. It works by destroying cellular membranes and wrecking the essential proteins and nucleic acids in a huge range of pathogens. That's exactly why it's the standard recommendation in so many clinical protocols.
In practice, you're almost always going to see hypochlorite as a granular powder, and that formulation is pretty clever, actually. It does two things at once. It disinfects, obviously, but it also helps to solidify and contain the liquid spill, which makes the cleanup way easier. You just apply it directly, spreading the granules over the whole spill to make sure it gets to work right away.
Section 3, critical safety precautions. Now, because hypochlorite is so effective, you've got to handle it with care. The safety measures we're about to cover are just as important as the cleanup procedure itself.
So what are the actual dangers we need to be aware of when we're using these chlorine-releasing agents? There are two big ones.
The first hazard is respiratory. Chlorine gas can be released, and that's an inhalation risk you don't want to mess with, especially in small rooms or areas with poor airflow. The solution is straightforward but absolutely non-negotiable. You have to make sure the area is well ventilated before, during, and after you use it. And here's the second hazard. This one is a very specific chemical no-no. You must never, ever mix chlorine-releasing agents directly with urine. Why? Because that combination creates chloramine gas, which is highly toxic if you breathe it in. This means any protocol for cleaning up a urine spill has to be different to avoid this dangerous reaction.
Section 4, let's get into the step-by-step of managing a spill. This is the clear, actionable framework you need to follow every single time.
First things first, before you even get close to the spill, you have to put on your PPE. Full personal protective equipment is mandatory. We're talking a plastic apron, disposable gloves, a face mask, and eye protection, like goggles or a visor to protect you from any splashes. This barrier is absolutely essential.
The procedure really boils down to 4 key steps. 1. Get that PPE on. 2. Apply the granular hypochlorite, making sure you completely cover the spill. 3. And this is a critical step people sometimes rush, you have to allow for the required contact time. Check the manufacturer's instructions. Disinfection isn't instant. It needs time to kill the microorganisms. And finally 4. Once that time is up, you can safely scoop up the solidified waste and dispose of it as clinical waste following your facility's guidelines.
Now, I want to highlight a huge procedural error that you have to avoid. Using a mop. Just don't do it. A mop doesn't contain the spill. It actually does the opposite. It can aerosolize the pathogens and just spread them over a much wider area, making the contamination even worse. The goal here is containment and removal, not dispersal.
Section 5, Virkon. Okay, so while hypochlorite is the standard, you might run into different protocols. Some places, like certain NHS trusts, for example, recommend an alternative called Virkon.
So what is Virkon? It's a multi-component disinfectant that works differently than hypochlorite.
Its main active ingredient is potassium peroxymonosulfate, which is another oxidizing agent, and it's mixed with surfactants and organic acids. It has a really broad spectrum of activity, and it's known to be effective against tough customers like HIV, hepatitis, and even MRSA.
So just to quickly compare the two, hypochlorite is your classic chlorine-releasing agent with those specific hazards we talked about, the gas and the reaction with urine. Viracon is a different class of disinfectant altogether. But honestly, the most important takeaway for any chemical agent is this: always consult the manufacturer's safety data sheet. That's your go-to for all the detailed handling and safety info.
And that brings us to our last and maybe most important point. The principles we've covered today really are the gold standard for infection control. So I want you to take a moment and ask yourself, what are the protocols in my own place of work? Do they line up with these best practices? Because knowing, and more importantly, following your local policy is the final, crucial step in keeping everyone safe.